Hello. So this is chapter 19, Hidden Faces of Substance Use Disorder. Introduction. The image that many have of a typical person with a substance use disorder is incorrect. Most with a substance use disorder are not the skid row alcoholic drinking liquor out of a brown bag or a heroin addict with a belt wrapped around the arm and a needle ready to inject. Substance use disorders impact all types of people, of different ages, races, socioeconomic statuses, and so on. Substance use disorders and the homeless. Addiction and the homeless. Substance use disorders are the most common psychiatric issue for homeless people. Many use substances to cope with circumstances that led to homelessness. The role of the individual's substance use in the loss of one's home is complex, and there's not always a casual relationship. About 65% of homeless people over 50 years of age have a moderate to severe SUD, whereas nearly 26% meet the criteria for a mild SUD. SUDs in the military. There's a problem that many people know exists but have ignored for a long time. Quote unquote, it's the elephant in the room. Recognized as a significant problem in the mid-1970s, one positive test result in mandatory treatment, while a second result in dishonorable discharge. 20% of active military engaged in heavy alcohol use, 47 in binge drinking, 32 of veterans have an AUD, 20% have other SUDs. Combat veterans and substance use disorders. Those who have been in combat are particularly susceptible to substance use disorders, especially with the use of alcohol. Substances may be used to self-medicate against the trauma of combat. There are several barriers to seeking and receiving treatment. Many military units have a culture of drinking. Substance use disorders in the LGBT communities. Research is typically focused on gay men, while lesbian women and bisexual and transgender people have been largely ignored. LGBT persons make up between 2 to 9% of the population, but 30% of these individuals may have some form of SUD. Such problems reflect the vulnerability of this population in many ways. It's escape from stress, living on the fringes of society, reduced socialization. So, substance use disorders in the LGBT community, 2 of 2. Use of methamphetamine in LGBT population is higher than the general population. Lesbian or bisexual women have a greater tendency toward alcohol use, or AUDs, while bisexual or gay men are at greater risk for other illicit drug problems. Treatment research is sparse, but it appears that lesbian or bisexual women are more likely to seek treatment than gay or bisexual men. Geographic barriers may exist. Specialized 12-step programs may be useful, but research is lacking. Substance misuse in individuals with a disability, 1 of 3. About 12.6% of Americans have some form of disability. People affected by the most common forms of disability in the United States. So we have hearing loss, percentage of people 3.6, vision 2.3, cognitive 4.8, ambulatory 6.6, self-care 2.5, and independent living 4.5. There is a general lack of adequate research into SUDs and people with disabilities, but SUDs appear far more common. 62% of such people have an AUD. Many clinicians are not trained to be sensitive to the needs of those with various disabilities. For example, very few therapists can use ESL. Ironically, many drug dealers do focus on this so that they can serve a wider customer base. traumatic brain injuries. In the United States, 3.2 million people are impacted by a disability resulting from a traumatic brain injury. About 10 to 20% of those with a traumatic brain injury struggle with an SUD. Denial is a major issue that complicates diagnosis and treatment. Factors to consider. Did the SUD predate the TBI? Was the SUD involved in the TBI? And did the SUD develop after the TBI? Ethnic minorities and SUDs. 1 of 5. SUDs in ethnic minorities may follow a different trajectory than SUDs in Caucasian individuals. Rehabilitation programs may be equally as effective, but ethnic minorities face a problem of limited access. Acculturation presents another risk factor. Native Americans. Cultural factors may promote AUDs and SUDs. There is highest rate of SNS stimulant misuse of all ethnic groups. AUDs tend to be higher in men than in women. Treatment research is lacking. Hispanic clients. About 16.7% of U.S. population was Hispanic in 2015. Heavy alcohol use is seen as male activity in this culture. Special treatment needs exist, but only 1/3 of treatment facilities are sensitive to this need. Individuals who are Hispanic may face longer delays, less active treatment, and be less likely to be referred to a residential treatment facility. Asian Americans. Women are likely to abstain in many Asian subcultures, but is quite varied. About 20% of American women, use alcohol, while 67% of Japanese American women do so. Methamphetamine is the largest issue across groups. African Americans. They started heavy drinking later in life than Caucasian males. Intergenerational variations complicate the issue. They are likely to receive very different treatment than Caucasians. It seriously complicates recovery. So that's it for this video. Thank you for listening.